Hi there, everybody. It's Dr. Steve here with Start Your Healing Now. This is part 2 for low back pain and disc issues. And so in part 1, we talked a little bit about sitting, some of the sitting posture that can play into it. And then we did a stretch for the hip flexors, which the hips being below the low back. And so today what we're going to do is we're going to go into the thoracic spine or the trunk. We're going to get that moving because the poor little low back, it's stuck in between the hips and it's at the mercy of everything that's going on in the hips. And it's also just below the thoracic spine or the trunk. So it's at the mercy of everything that's going on in the upper back where the arms are attached and they're reaching for items in space. And so the low back has to deal with everything happening from below and everything happening from above. So we started with some of the below approach in the last video. In this one, what we're going to do are some arm swings to get the thoracic spine moving and to get it feeling and functioning better. So using something like a post, a wall, a dresser, it doesn't really matter what, but putting your hand onto something is helpful because it's going to fix and stabilize one hand while the other hand we're swinging in these different directions. So we're going to start with this rotation motion. So one hand is just kind of hanging onto something in front. The other hand, you're reaching under, rotating kind of a thread the needle motion, and then reaching back and opening up. So going back and forth here. You want to let the whole body play along with the motion so that it's not just the arm going with the rest of the body staying still, but we want to let the motion kind of transfer all the way down into the hips, the legs, and have everything playing along with the turning. So then we would go into the side to side motion. And so I'll give you a different angle in just a moment to see. But now the hand is right along the side of my body and going up overhead. I very often call this one the rainbow wave or kind of the bon voyage wave. But we're going to do the side to side. And then we're going to do a down and up. So down and up here. So as the hand comes down, the body bends a little bit. As the hand comes down, the body comes down. As the hand comes up, the body comes up. So we swing through. This is getting the upper back moving to make life better for the low back. So now to give you just a different angle. So this is what it would look like if I was at a wall, reaching under and back with the first one for the rotation reaches. And again, letting everything turn together. And then for that side to side rainbow wave, this angle gives you a little better view where the hand is swinging up side to side. And notice that the hips are going with it. So we're swaying through the hips. And then the down and up is where your hand comes down, the body drops down a little bit. And then as the hand comes up, the body comes up a little bit. So that one also fits very cleanly into our 2-minute stretch format. So you've been sitting working at the computer or you've been driving, you've been kind of stuck in a seated position for a while. That tends to gum up the thoracic spine, the trunk. Take 2 minutes and say, okay, I'm going to do 20 seconds, 20 seconds, and 20 seconds each. Switch arms and repeat, and there in 2 minutes you get a lot done. That 20 seconds works out to be about 8 to 10 repetitions. So you can just kind of find your spot and say, okay, let me do 10 reps of these, 10 reps of these, and hit both arms. And in 2 minutes, you've really gotten a lot of blood flow and motion and lubrication and opening up the ribs and the lung and the spine. All good stuff for you. So that is your part 2 of Start Your Healing Now for your low back disc issues. Be sure to stay tuned for part 3. That'll be coming up where we're going to take it just a little further. And don't sit at home and suffer on your own. If you or anybody you care about is struggling with some back pain, bring them in, let's talk, let's figure out what's going on so we can help them feel better and function better and get you back to finding the relief from pain and the freedom in your body to do what it is that you love to do. So until next time, bye-bye everybody.